Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome to today's presentation, Palliative Care, an Extra Layer of Support. Our speakers are from Washington Hospital's Palliative Care Services. Nurse practitioner Bernadita Roe is the clinical coordinator, and Dr. Vandana Sharma is the co-medical director. They are part of a team providing the support patients and their families need when facing chronic or life-threatening illness. Without further ado, please welcome Bernadita Roe and Dr. Vandana Sharma.
Thank you for tuning in and listening to us talk about what palliative care is. We hope that you're going to be able to understand what palliative care is, so it'll help you decide if this is the right service for you or your family. So many times people have a misunderstanding of what palliative care is. Dr. Sharma, how do you define palliative care?
So palliative care is a medical specialty which involves services from a multidisciplinary team, and it's suitable for patients who have been diagnosed with advanced illnesses or complex medical conditions. And the focus of palliative care is to improve the quality of life, improve symptoms, reduce suffering. And one of the things that makes palliative care different from other medical specialties is that we focus on the whole patient. We focus on how they're connected to their community, their caregivers, as well as focusing on reducing suffering. So it's not just looking at one isolated organ system, it's really focusing on the needs of the whole patient.
Okay. Who is on the palliative care team if it's an interdisciplinary team?
Right, so the team consists of different types of providers. So there's clinicians who can be a physician or a nurse practitioner. So individuals who are really experienced with dealing with the medical issues, symptom management, helping somebody understand how is their disease impacting their life, sort of the medical issues that are involved. There's often a spiritual coordinator, because we know that people don't live in isolation. We live in our broader cultural system, and that also involves religion. The social worker, who's very integral to the team. And then we can bring in other specialists based on needs, such as nutritionists, physical therapists, other sorts of specialists based on the person's individual need.
What type of diseases or serious illness does palliative care address?
So any disease that maybe has a long trajectory, that may be a very chronic disease or very serious disease. So first thing you can think of is something like getting a cancer diagnosis. So somebody who's been diagnosed with a new cancer or an advanced cancer or a cancer that's progressed on their current treatment. But it's not just limited for that. It's really helpful for people who have other advanced diseases such as COPD or emphysema, advanced heart disease, advanced dementia, anything that's going to impact their quality of life and be a complex medical condition that is going to extend over their life.
Okay. How does a person benefit from these services who have these serious illnesses?
So what palliative care does is it provides an extra layer of support to the patient, to their family, and then also actually to their care team. So palliative care services can help an individual determine what life choices they want to make, what choices they want to make in terms of advanced medical treatments, but also in terms of symptom management and helping sort of adjust perhaps to a new normal based on their new diagnosis.
Okay. How does palliative care help with goals of care? So if a person has a disease, and we hear a lot about goals of care with diseases, how does palliative care help figure out what those are?
So goals of care is really important, and a person's goals of care may change, and usually do, throughout their lifetime. So the goals that a person has, when they're 15 or when they're 30 are likely going to be very different when they're 60 or 70 or 80. So just as individuals find that their goals of care may change in life, it can also change based on what medical conditions they have. So if somebody has gotten a diagnosis of an advanced medical disease, and maybe that impacts their mobility or maybe even impacts their life expectancy, they might find they have a new set of realities that they have to deal with and contend with. And with palliative care, our team can help a patient prioritize their goals personally, but also identify what their goals may be medically in terms of what kinds of treatment they're willing to participate in, what types of interventions they may want if they become seriously ill. So whereas somebody may want artificial life support when they're young, if they're older or if they're now diagnosed with untreatable cancer, they may have a different idea about their feelings about something like artificial life support. So the palliative care team can help sort of identify and define those goals of care, but also be there to support them as the patient's illness goes through its normal trajectory, and those goals may change over their lifetime.
Okay. That's really helpful to know that once a person sets their goals that they could change.
Absolutely.
And it doesn't stay just this goal forever. That's really helpful. I hear a lot about advanced care planning. What does that mean, and why is that important?
So advanced care planning is very important because it gives you the opportunity to think about what does the future look like to you? What are the things that are important for you in your future with regard to your health? And one of the key elements of advanced care planning is setting what's called a surrogate decision maker. So a surrogate decision maker is the person that you designate to make medical decisions for you when you cannot make them for yourself. So it's basically the person who will speak for you if for some reason you cannot make your own medical decisions. So it's important before that time happens to be able to identify who that surrogate decision maker is, but also share with them what your goals are, because you want to be sure that it's your wishes that are being carried out.
Okay. Then how does advanced directives tie in with the surrogate decision maker?
So usually an advanced directive is a document, it's usually a legal document, in which that surrogate decision maker is identified. That person is identified as the surrogate decision maker. Usually there's an alternate, so somebody who's picked as a secondary surrogate decision maker. And the advanced care directive then can outline what specific things you want for your health care in terms of things like artificial life support, artificial nutrition, all of these things that maybe we don't like to think about, but honestly are very important to define.
Okay. So if a person wants to see the palliative care team, do they continue with their primary doctor or the specialist, or does the palliative care team take over? How does that all work?
So we work in conjunction with an individual's care team. So they keep their primary care doctor, they keep all their specialists. We are an extra layer of support for them. So we don't replace the primary care doctor, we don't replace the specialist, we're an additional layer of support for them. So we work in parallel with the rest of their team and actually together with their other team members.
Okay. How can a person access palliative care?
So a person can access palliative care if they're an outpatient by requesting palliative care consultation from their primary care physician. So we have an outpatient clinic where we see patients and they can be referred to us by their primary care clinic. If the patient's an inpatient and their doctors or nurses or anybody thinks that they would benefit from palliative care, or they themselves want palliative care, they can ask their attending physician, and we can see the patients if they're inpatients as well.
Okay. Well, we hope that the information that we were able to provide gives you a better understanding of what palliative care is, so that you can make decisions if this type of care is right for you or a loved one. We'd like to open up questions and answers to you, so please log in and see if we...
Great. Bernie, I have a question. Palliative care can be a difficult conversation. I have a younger cousin in her early 30s with MS. Sounds like she would benefit from palliative care. Do you have tips on how a family member can start this conversation of introducing palliative care?
Yes, absolutely. That's a good question. Let's see. So first of all, I think a lot of the information that we talked about in this talk might help. I think the first thing is to get an understanding of what your family member knows about palliative care, and then help them understand that palliative care is for people who have serious illness. Palliative care is a team approach to support goals of care, to partner with their primary doctor and their specialist to try to improve quality of life. It's not end of life, it's really partnering through their journey of their disease.
Dr. Sharma, can someone's health improve and no longer need palliative care?
Absolutely. If somebody finds that the palliative care services are no longer needed, they would just return 100% to the care of their primary care doctor. And if a change happens where they're now faced with a new situation, they can come back and be seen in the palliative care clinic again. So palliative care is really intended to be there to help improve a person's quality of life, help reduce their symptoms, help reduce their suffering. But if those needs aren't there anymore, then it's certainly absolutely appropriate to step back from the clinic and just be followed by primary care.
Bernie, what happens if my loved one's health condition worsens while on palliative care?
So if your loved one's condition worsens, what would be important to first identify is what the goal of care is. There are usually two pathways. Do we continue medical management? Because if their health care worsens, then should we focus on symptoms? Should we focus on other interventions? Where's the focus? Continuing medical management? Or if a person says, if the goal of care is they no longer want to seek medical management, then what we would do is just have further conversations on what they would want to do. So depending on where the person is on their, what we call trajectory of disease or on their journey of the disease, having these goals of care conversations are important to help guide the medical treatment decisions that need to be made. So it really depends on what the goal of care is when we're talking about what's the next steps.
Dr. Sharma, at what stage of someone's serious illness should they start palliative care? Is it ever too soon?
It's actually never too soon to get involved with palliative care. The data actually shows that individuals who receive palliative care in parallel or in addition to the standard of care actually have a better quality of life, reduce symptoms, and often actually live longer. So it's never too late to meet with a palliative care team or ask for a referral to the palliative care clinic. And it may be a situation where we meet once or twice and and then don't have any follow-up for a long time or ever, or it can become an ongoing relationship. So I would say it's never too soon for palliative care.
Okay, and our last question. Dr. Sharma, is palliative care for end of life? Is this the same as hospice care?
So palliative care and hospice care are very different because palliative care can be received and administered in conjunction with any other kind of medical care. So for example, if a person has cancer, they can receive palliative care as well as chemotherapy, surgery, radiation, whereas hospice is really intended for the end-of-life care. So unlike hospice, where people generally just focus on symptoms and no longer receive aggressive medical treatment, with palliative care, we're focusing on symptoms, improving quality of life, reducing suffering, but in parallel with other medical treatments.
This concludes our program. Thank you, Bernie. Thank you, Dr. Sharma, for your expertise. And thank you to our viewers for tuning in. The entire broadcast of today's event will be available on Facebook and YouTube.